I'm Janet Caldwell-Cover. I am a research assistant from UConn Health, Occupational and Environmental Medicine, as well as an advisor on the UConn High-Tech team. The High-Tech Healthy Workplace Participatory Program is a nationally recognized bottom-up approach supporting workers' health, safety, and well-being in corrections. High-Tech is short for Health Improvement Through Employee Control. The High-Tech frontline workers participate in creating solutions in their workplaces based on their knowledge of the problems and/or areas that need improvement.
So High-Tech is a group of people from diverse backgrounds and job classifications working with UConn Health and all the positive research that they've done along the way that's proven to create a better work environment here. So we have administration involved, we have MP4 staff, we have UConn Health, we have the union involved. With all these entities involved together, I think we have a powerful structure to create change in the work environment.
The uniqueness of the High-Tech project is it's worker-centric, i.e. it amplifies and focuses on the voices of the workers to identify the issues that they deal with in the workplace. It is in alignment with the U.S. Surgeon General framework on mental health and well-being of the workforce, which centers on the workers' voices to enhance the workplace.
So the process is getting the workers to be involved in the solutions, because the workers are the ones that know what's going to work for them in the long run. It's not a top-down approach, it's a bottom-up approach.
Through the High-Tech program, frontline staff and administrative leaders work together towards finding and implementing new interventions to improve the workforce's work-life quality and well-being.
The High-Tech Healthy Workplace Participatory Program has helped the DOC in many ways. Sometimes we're focused on the offender population, but High-Tech has helped us to focus on the staff and what the workplace means to them and what the workplace is for them.
We spend a lot of our days here, 16 hours most of us spend, and that's a really long time. So having an environment that focuses on our work-life balance, an environment where we're happy to come to work, where we can grow as individuals is important.
Having the High-Tech program and being able to work with UConn, it's allowed us to receive the guidance on how do we allow our staff members to have that quality life, to be able to come to work. Yes, you may have stressors at work, but how do you decompress, give those tools so that way they can go home and still have that quality life.
Interventions created by the design teams are solutions to a problem that are collectively agreed upon and implemented with management approval. Administrative support and collaboration with the design teams are essential to making effective change.
One of the most important things that I would say about being a part of the design team, you get to have a voice. You sit down with administrators, you sit down with your wardens, you sit down with your DC, and you sit and you talk about issues that affect all. You have ability to affect change and change the culture. That is one of the things that design team is working on, changing the culture of the Department of Corrections. We know that sometimes we feel like we are the forgotten ones behind the wall. And one thing I will tell any members that decide to join the design team, you have a chance to be heard.
We all have special, unique skills. Bring a team together that can look outside the box and bring individual life skills in it.
One of the interventions that we implemented was a report writing area. Staff for years have been handwriting reports, which is oftentimes very, very difficult to read. They are legal documents, which oftentimes do end up in court and viewed by lawmakers, administrators, and they needed to be cleaned up. So we identified the need of a report writing area. So we were able to get an area reserved for staff, multiple computers, a generic logon, where staff could log onto the computer, access the reports that they needed to complete and submit, and able to do so in a clean manner and make corrections easily.
We focused on mental health issues. We focused on physical issues. We also looked into financial literacy. We realized how important that is to staff, especially young staff.
Other initiatives as well focused on sleep habits and mental health training for the supervisors. All these are examples of issues that were identified by the workforce, and the interventions or the solutions were developed, implemented, and evaluated by the correctional officer workforce itself.
The Department of Correction is committed to the high-tech program, and one of the things that we've been discussing at the executive level is how do we incorporate this in our policies? How do we incorporate this in our directives? So our commitment to expanding the program is to make sure it's embedded in our daily operations and in the daily work that we're doing.